In this video, I am discussing rheumatic fever. Rheumatic fever comes on history and also clinical. Sometimes they ask. So we know that some basic line rheumatic fever. It is an inflammatory disease, non-supportive, primarily present in 5 to 15 years age of old. It is a beta hemolytic streptococci group A tonsillopharyngitis. It is an autoimmune disease, herpes simplex virus type 2. So this is what are the clinical features? Very important. That is Jones criteria and mnemonic is Jones Cafe Pul. So Jones, the criteria, Jones, J for joint involvement, O for myocarditis, N for nodule or subcutaneous nodule, E for erythema marginatum, S for Sydenham chorea. Then CAF people, C for CRP increase, A for arthralgia, F for fever, E for elevated ESR, tall, P for prolonged peer interval, A for anamnesis of rheumatism, and L for leukocytosis. And diagnosis, two major criteria or one major criteria and two minor criteria. Okay. So, plus throat swab, throat culture, growing group of beta hemolytic streptococcus or elevated anti-streptolysin O titer. So, a pneumatic fever history come on exam. In history, what we find, first of all, we find that is some throat swab with tonsillitis or pharyngitis history present. Then arthritis, joint involvement, or like myocarditis, that is some cardiac problem like chest pain or palpitation. Then some nodules in the body, rash, that is erythema marginatum rash, eye problem, and movement problem, abnormal movement, that is Sydenham chorea. Then fever present, ESR, CRP increase, arthralgia, I already told you. So these are the features we can be finding the history when we take. And what are the investigation we do for rheumatic fever? So CBC, full blood count, WBC count will be increased, and ASO titer is increased, anti-DNS level is increased. Inflammatory marker ESR CRP is increased, echo we can do, and throat swab culture is positive, and ECG. What is the treatment we give and rheumatic fever patient? Bed rest, then procaine, benzyl, penicillin, IM, aspirin high dose, prednisolone, treat the chorea if occur. If at high risk or there is past history of rheumatic fever, we give the prophylaxis, that is benzathine penicillin or daily phenoxymethyl penicillin. And as usual, the cardiac advice we give, this including good oral hygiene, restriction of exercise not indicated except in case of severe aortic stenosis and hypertrophic obstructive cardiomyopathy. So good oral hygiene, restriction of exercise with cardiac advice, avoid piercing and tattooing, good nutrition, plus minus antibiotic prophylaxis, and if cyanotic, avoid the high altitude, take iron supplementation, prophylaxis against the infective endocarditis and valve replacements and infective endocarditis, use of anticoagulant. And we will involve the team, multidisciplinary team, this is dietitian, cardiologist, cardiosurgeon if indicated, dentist, lies with the school, support to the family. So this is all about the management portion of rheumatic fever. It comes on history also. You can face on the um, clinical as mitral stenosis stations. Thank you.